what we can do for our patients. Even we look at the literature, the incidence of heart failure is quite common. And as just Dr. Satish George has just mentioned that this heart and kidneys are intimately, they are talking to each other. They have cross-talk. They are intimately linked. So we have cardiorenal syndromes. We all know they are further categorized in 5 classes. The first 2 classes is cardiorenal syndrome. The next 2, class 3 and class 4, is renocardiac syndrome, and the 5th is a disease involving both cardiac and renal disorder. So from ages we know the condition of heart can deteriorate your renal function, and the condition of kidney can deteriorate your heart function. So why this is a lethal combination? So when we look at the literature, the prevalence of kidney dysfunction in heart failure is almost 50 to 60%. And more than 40% of heart failure patients have chronic kidney disease. And this close relationship between chronic kidney disease and heart failure worsens their prognosis. Because when the patient have heart failure and kidney dysfunction, they not only progresses the condition of each other, but they have multiple comorbidity as well, like fatigability, inactivity, malnutrition, inflammation, catabolic action, and muscle loss. So because of this, they have exercise intolerance and lots of other problems. So this is the lethal combo when a patient have both chronic kidney disease and chronic heart failure. And it has been seen that heart failure has a wide clinical implication, including the potential for kidney damage. How they damage the kidney. First of all, how we define heart failure. Basically, it's a condition where heart cannot meet metabolic requirements and unable to accommodate systemic venous return. And in return, what happens? There is a RAS activation, there is sodium and water retention, there is vasoconstriction, and we have few compensatory mechanisms to restore this cardiac output, like increased venous pressure, there is increased sympathetic nervous stimulation, and there is increased natriuresis. And that led to worsening your kidney failure that may be because of hypoperfusion, apoptosis, and fibrosis. So there is a vicious cycle. With worsening heart failure, they impact the renal function, and the worsening kidney failure is again worsening the heart failure condition. And that's here a role of nephrologist and cardiologist came to break this vicious cycle. So what we can do for our patient in my next few slides, I'm going to share a few literature and the management. Now, this is a very important slides. Look, these are the hypothetical slope, the curve of a CKD patients. So on an average, we can expect a CKD population is decreasing their GFR by 10 milliliter per minute per decade. So this blue line is the usual CKD slope. And if we manage well, that patients may not achieve the stage of end-stage renal disease. This light pink is stage of end stage, where GFR is too low and patient's kidney needs support in the form of renal transplantation or hemodialysis. On top of that, if patient has heart failure and look at this hypothetical curve where there is an increased rate of progression, and what I was saying that it's 10 ml per minute per decade, it increases to 20 to 30 milliliter per minute per decade, and that makes patients susceptible to go into stage of end stage where the requirement of dialysis or transplant is inevitable. So that's the reason why the combo of heart failure and chronic kidney disease is quite deleterious. Now, when we look at this study, which was published in 2018, and they compare the all-cause mortality and cardiovascular disease-specific mortality in patients with heart failure. When they did the subgroup analysis, look at the curve. This blue curve is for heart failure only. This magenta color curve is for type 2 diabetes with chronic kidney disease. This green color is patients with CKD and heart failure. And the lower one is patients with type 2 diabetes, chronic kidney disease, and heart failure. And look at the cumulative survival. It's worse if patient is having chronic kidney disease and heart failure. Similarly, when we compare this cardiovascular disease-specific mortality in patients with heart failure, look at the lowest curve, that is the patients with type 2 diabetes, CKD, and heart failure. And look at the separation. It is quite early in their feature. This is a long-term study. Almost the population is studied to 10 to 15 years. And look at the separation of curve.